This presentation is the effects of nursing simulation education about child care with acute asthma attacks on the problem-solving process and self-efficacy for nursing students by Nayoung Choi. Contents. First, introduction. Second, methodology. Third, results. Fourth, discussion. Introduction. Background. There are situations where the child patients that nursing students treat in clinical practice training at the general hospital are more acute and better-proof than other patients. There has been an increase in interest towards simulation education and its application towards clinical training in order to overcome their difficulties and to improve the patient's safety and clinical care. Therefore, in this study, scenarios of the most common occurring pediatric disease of acute asthma is reproduced in order to test if the effects of its efficacy on nursing students via a simulation education program. Purpose of study. The purpose of this study is to develop a nursing simulation-based education program with clinical situations of children with acute asthma attacks and to confirm the differences in problem-solving processes, self-efficacy, and satisfaction after applying a video education. Hypothesis. Hypothesis 1. There will be a large difference in problem-solving processes score between the experimental group who received simulation-based education on children patients with acute asthma attacks and the control group who received just video education. Hypothesis 2. There will be large differences in self-efficacy scores between the experimental group who received simulation-based education on children patients with acute asthma attacks and the control group who received just video education. Hypothesis 3. There will be large differences in learning satisfaction scores between the experimental group who received simulation-based education on children patients with acute asthma attacks and the control group who received just video education. Methodology. Study design. This study develops a nursing simulation scenario for educational processes based on children patients with acute asthma attacks. A non-equivalent control group pre-test, post-test design is used to quantify the score differences via a questionnaire survey in the control group and experimental group to test the efficacy of the simulation program. Sampling of research subject. To calculate the sample size of the study, the G-power sample size computation program was used along with ANOVA repeated measure. Interaction variables and the parameters of the effect size at 0.25, statistical significance at 0.05, statistical power at 80%, and correlation coefficient at 0.3. The sample size computation yielded that a sample size of 23 for both the experimental group and control group was required. Research 2. Problem-solving process. In order to measure the problem-solving processes of the subjects, the metric developed was modified and complemented after analysis. In addition, 3 nurse professors computed the validity coefficient in order to examine the content validity of the study. Self-efficacy. The self-efficacy criterion was modified after examination and content validity verification from the 3 nursing professors. Research procedure. The simulation scenario developed stages. This study developed simulation scenarios on different nursing processes on children patients, based on examples in pediatric nursing textbook materials. After careful validation and examination by 2 child nursing professors and 1 pediatrician. The scenario is mainly constructed of a 6-month-old child patient who is diagnosed from acute asthma attacks a day prior and has difficulty breathing. Next, data collection stage. After receiving approval and signed from the third-year nursing students, the survey data was collected. General characteristics of subjects. The general characteristics of the subjects of the simulation-based nursing education program on child parents with acute asthma attacks were verified. Hypothesis 1. In order to test Hypothesis 1, the problem-solving processes score of both the experimental and control group were verified before and after the program. Therefore, it was observed that there wasn't statistically significant differences. T is 0.05 and Hypothesis 1 was dismissed. Hypothesis 2. In order to test Hypothesis 2, the self-efficacy scores of the experimental and control group were compared before and after the program. Therefore, it was observed there was a statistically significant differences in self-efficacy scores. T is 3.08 between the two groups, and Hypothesis 2 was supported. Hypothesis 3. In order to test Hypothesis 3, the learning satisfaction between the two groups were compared before and after the program. Therefore, it was observed that there was a statistically significant difference of score increases between the two groups. T is 3.46 and Hypothesis 3 was supported. The comparison of variables, problem-solving process, self-efficacy, and learning satisfaction as is follows. Discussion and conclusion. The simulation-based training was inferred to have brought higher interest to the material because the students were able to actively experience the nursing situation at hand. This resulted in higher self-efficacy and learning satisfaction in the students. There is significance in the fact that the simulation-based nursing training on child patients with acute asthma attacks was able to increase the students' self-efficacy and learning satisfaction infection. Further research on extended simulation-based nursing training programs on various subjects and a wide range of illnesses is required to fully understand the positive and negative effects of these nurse simulation-based education programs. References is as follows. Thank you for listening my presentation. Thank you.